Awaiting a blessing, Miss Smith's pregnancy journey begins. At 49 years old, Miss Smith was about to embark on a journey she thought had passed her by motherhood. The joy of discovering her pregnancy was quickly met with the weight of responsibility, especially given her age. Being categorized as a high-risk pregnancy due to advanced maternal age, Miss Smith diligently followed her doctor's recommendations. This included a battery of prenatal screenings and tests designed to ensure the well-being of both mother and child. One such screening was non-invasive prenatal testing, or NIPT, a simple blood test offered to pregnant women to assess the risk of certain chromosomal abnormalities in the fetus. Miss Smith approached this new chapter with a blend of excitement and apprehension. The first trimester was filled with doctor's appointments, prenatal vitamins, and the roller coaster of early pregnancy symptoms. Yet, the promise of holding her own child in her arms kept her spirits high. When her doctor suggested NIPT as part of her prenatal care, Miss Smith readily agreed, hoping for reassurance and a clearer picture of her baby's health. Little did she know this test would mark a turning point in her pregnancy journey, leading her down a path filled with difficult choices and unwavering determination. Miss Smith's decision to undergo NIPT stemmed from a desire to be informed and prepared. She understood that knowledge is power, especially when it comes to her baby's health. With each passing day, her anticipation grew, as did the profound sense of connection she felt with the tiny life developing within her. Miss Smith eagerly awaited the NIPT results, hoping for a positive outcome that would add to the joy and excitement of her pregnancy. Unforeseen challenges, high-risk screening and diagnostic confirmation. The NIPT results arrived, casting a shadow of uncertainty over Miss Smith's pregnancy. The screening indicated a high risk for trisomy 21, more commonly known as Down syndrome. This news, while not entirely unexpected given her age, left Miss Smith feeling a mix of emotions, fear, anxiety, and a sense of overwhelming responsibility for the life growing inside her. Her doctor, a beacon of calm and support, explained that NIPT, while highly accurate, is a screening test, not a diagnostic one. A screening test, like NIPT, assesses the likelihood of a condition but doesn't provide a definitive diagnosis. To confirm the presence of trisomy 21, a diagnostic test would be required. In Miss Smith's case, the doctor recommended chorionic villus sampling, or CVS, a procedure that analyzes a small sample of placental tissue. CVS is typically performed between 10 and 13 weeks of pregnancy and offers a definitive answer regarding chromosomal abnormalities. It was a lot to process, but Miss Smith knew that knowledge was paramount in making informed decisions about her pregnancy. Faced with this unexpected challenge, Miss Smith found herself at a crossroads. The possibility of Down syndrome, while daunting, didn't diminish her love for her unborn child. It did, however, bring about a wave of new questions and concerns. What would this mean for her baby's future? What kind of support would be available? Driven by a mother's unwavering love and a thirst for knowledge, Miss Smith decided to undergo CVS to obtain a definitive diagnosis. Understanding the tests, screening versus diagnostic procedures. Navigating the world of prenatal testing can feel like learning a new language. It's crucial to understand the difference between screening and diagnostic tests. Screening tests, such as NIPT, assess the chances of a fetus having a specific condition. They provide risk assessment, not a definitive diagnosis. Think of it like casting a wide net to identify potential concerns. Diagnostic tests, on the other hand, offer a conclusive answer. These tests analyze fetal cells directly to confirm or rule out a suspected genetic condition. CVS and amniocentesis are two common diagnostic tests offered during pregnancy. While both provide definitive answers, they differ in their procedures and the timing during pregnancy when they are performed. Understanding the nuances of these tests empowered Miss Smith to make informed decisions about her pregnancy journey. She knew that a high-risk NIPT result didn't necessarily mean her baby had Down syndrome, but it did necessitate further investigation. Armed with this knowledge, she opted for CVS, seeking a conclusive answer that would allow her to prepare and make the best choices for herself and her baby.